was wondering what I could use in place of antibiotics. I'm allergic to them.
And what are you treating?
Like a sinus infection, throat infection.
Yeah.
So
most, the studies continue to tell us that the majority of sinus infections are not benefited by using antibiotics, and most of them, we don't. Although we have different ways of trying to figure out which ones will respond to antibiotics and which ones won't, the research tells us there's no good way of doing that. So it's questionable whether antibiotics are even necessary for sinus infections at all. I suspect there's probably a small percent, 5 to 10%, that would respond. Things to boost the immune system, making sure your vitamin D is nice and high. We use products like sambucol, which is elderberry, is an herb that helps to boost the immune system and help in sinus conditions. We use a lot of sinupret. Sinupret is a specific supplement that's made of a variety of herbs that comes from Germany. It's been shown to decrease the length of illness, specifically in sinusitis. Some of these things you can find over the counter. Some of them you'll need to work with a healthcare professional on, although they're still supplement-based. There's no medications. So that's kind of the list of things that we use for those specific issues.
What about something like a UTI?
Yeah, urinary tract infection. Again, some of those things are probably not going to work that I just listed. D-mannose may help decrease the connection of the bacteria to the bladder wall. But the other concern is, what antibiotics could you use? Because there may be a time in the future where, it's going to take, an antibiotic could be a life or death thing. So sometimes working with an allergist to really figure out which are true allergies and which are which are sensitivities. Because
we've already done that, and the only one I can use is $1,900 a week.
Yeah, so you definitely save that for really bad times. But as far as the bladder goes, besides the cranberry extract and the D-mannose, and again, those aren't necessarily for acute infections. You'd have to work on figuring out other ways. I'm not exactly sure what would be used there.